Some big news today regarding two of the vaccines available for use in the United States, Pfizer and Johnson & Johnson. Here to talk about all of it, because it's Friday, is Dr. Robert Finberg, who's the Distinguished Professor of Medicine at UMass Medical School. Thank you so much for joining us, Doctor. As always, every Friday, we really enjoy our time with you, and we appreciate it. First, Pfizer says it's asking the FDA to expand the authorization for use of its two-dose vaccine to include kids ages 12 to 15. What kind of evidence do they have to show that it's safe and effective for kids those ages? And do you think the FDA will even give that the green light?
I think it's very likely. They have evidence that it will provide protection and produce good antibody responses. And I think the FDA will be likely to approve it. I can assure people, though, that they're going to look in detail at all of the data before they do.
Dr. Finberg, COVID cases, they're surging right now in places like Michigan. Health officials say the spike is being fueled by cases among high school age children, especially high schoolers who play sports. Is there a similar situation here or in other areas, and could expanding Pfizer's reach help drive down those numbers?
Yeah, we are seeing this in younger people now, and it's possible that that relates to behaviors of young people. And I think, yes, I'm hoping that we will get that approved, and we will be able to start immunizing people in Massachusetts as well at that age, with that age group.
Doctor, the federal government, is it increasing the distribution of vaccines to states based on surges that they're seeing? And if they're not doing that, do you think that that's a criteria that they should be looking at?
Well, it seems logical to try to get the vaccine where it's needed, but the surges vary from community to community, and that can change very fast. And remember that you need at least several days to get efficacy from a vaccine. So I think right now the federal government is trying to get as many vaccines out to as many people as possible, and I think that's the right way to do it.
Well, now a question about one of the specific vaccines, the single-dose Johnson & Johnson. It's under a bit of scrutiny after 4 states paused vaccinations when several patients had adverse reactions. So are those unusual, and is there any indication the vaccine should get a closer look from regulators?
So the vaccine has had a very close look at regulators, and it's my understanding, based on what I've seen in the news media, you can tell me how reliable that is, that these reactions were things that we might expect to see with a vaccine, and that at the moment, based on the CDC investigation, we think it's entirely safe.
So, but why are these places in these different states, why were they canceling and saying go home? Because they had all of these reports, and they're not saying specifics, maybe some nausea with people. So that has people concerned here. We have a lot of Johnson & Johnson here in Massachusetts. So I just want to reiterate, you're saying people should take it.
My understanding, as your understanding, is that this was people with nausea, maybe vomiting, fatigue, these are all things that we would expect with a vaccine, and that they improved with hydration. And as far as I know, based on all the data available, this is a safe vaccine, and we are recommending that people take it.
All right. Thank you so much, Dr. Finberg. As always, have a wonderful weekend and stay well.
Thank you.